I'll be presenting on syphilis, a systemic sexually transmitted infection caused by the bacterium Treponema pallidum. This disease is important because although it's treatable, delayed detection can lead to serious complications and even death. Syphilis progresses through four main stages. The primary stage usually begins about 3 weeks after exposure with a painless sore called a canker at the site of the infection. Many people ignore this lesion since it doesn't hurt and may appear in hidden areas like the cervix or rectum. If untreated, the infection spreads. The secondary stage appears a few months later. Patients may develop rashes, swollen lymph nodes, fever, and mouth or genital sores. These rashes are often found on the palms and soles. In some cases, serious organ involvement may occur, including kidney or liver complications. If syphilis remains untreated, it moves into the latent stage where no symptoms are present, but the infection persists in the body. About 40% of untreated cases will eventually progress to the third stage, which is the tertiary syphilis, years later. This stage can be devastating, causing neurological problems, cardiovascular disease, and destructive lesions called gumas. It's also important to note that neurosyphilis, infection of the nervous system, can actually occur at any stage, leading to meningitis like symptoms such as headaches, fever, neck stiffness. Um, yeah. From a biological perspective, T. pallidum is a spiral shaped bacterium that moves using internal flagella. It grows very slowly compared to other bacteria and it cannot survive outside the human body for long, which is why close contact is necessary for transmission. This is kind of what it looks like here. You can see. So they're just like spiral like. They're kind of cute. Transmission happens mainly through sexual contact, genital, oral, or anal, but syphilis can also be passed from mother to child during pregnancy, leading to congenital syphilis. Rarely it can spread through blood transfusion or organ transplants, but usually they will, inform you of the potential risks that come with that. For the diagnosis, here. It's typically made through blood tests, including both treponemal and non-treponemal tests, or with PCR testing. Treatment is straightforward. Penicillin is a drug of choice of all stages, and it's highly effective. However, many patients experience the Jarishheimer reaction. I don't know how to pronounce that. But that's basically it's a reaction shortly after treatment begins. This includes fever, headache, and muscle aches, but it's temporary and it's not an allergic reaction to the medication. In terms of the epidemiology, syphilis cases have been increasing in recent years. Once most common among men who have sex with men, it is now rising in heterosexual populations as well, especially among women. This has caused a worrying rise in congenital syphilis. Limited healthcare access in rural areas also contributes to underdiagnosis. And then, to conclude, syphilis is a serious but preventable and curable disease. The key is early detection, treatment, and prevention strategies, including safe sex practices, routine testing, partner notification, and strong public health education. With coordinated efforts, we can reduce transmission and protect vulnerable populations. And that's here. If you see, this is like the area where you can get like cankers and so disgusting. Use condoms, guys. It's not hard. But stay safe.